Yo. Okay, let me put this up so y'all know exactly what we're doing. I should have posted in the thing. Okay, here we go. Boop, boop. All right, I'm going to give y'all some time to get into the room. When you get here, you already know what it is based off what you see here. NCLEX Jeopardy. All right, now, my bad for missing Tuesday. I know it wasn't Jeopardy. I know it wasn't NCLEX stuff. It was T's. I'm going to make it up to y'all. But we are here today for NCLEX Jeopardy, our weekly review. And we're going to have it in the app as well. It's going to be... Ooh. Okay, whatever. Cool. Let's do it this way. How y'all doing today? All right, so tag whoever you need to tag that may need a review for the NCLEX, whether it's NCLEX RN, NCLEX PN. This is going to help. All right, so hello, my loves. Hold on 1 second. I'm gonna go back to this. All right, so if you guys have not joined me before for NCLEX Jeopardy, hello, how are you? Please let me know if it's your first time right here down in the comments. I'm just gonna run through kind of like an overview of how we play the game, and then we're gonna get into it. Okay, so as you can see, this is your NCLEX Jeopardy. Do you have anything for the T's? I do. If you check out my website, the link in my bio, I have a whole section. I have a whole bundle on T's. All right. So we have our in true Jeopardy style and Jeopardy fashion. We have our 5 categories. I don't know if they have 5 categories in Jeopardy. I don't remember. But for tonight, we have our 5 categories right here. We have 5 questions per category. I sure was. So these are our categories for tonight: pharmacology, pediatrics, mental health, fundamentals, and adult health, which is med-surg, patho, whatever you want to call it, or a mixture of the two. We have 5 questions per category, ranging from 100 points to 500 points. So I'm going to select whatever question worth whatever points. I'm going to show it and read it, and you guys are going to answer. Now, just like with Jeopardy style, you have to say what is. Okay, so if the choices are 1, 2, 3, 4, A, B, C, D, whatever, you're gonna say what is 1, what is B, what is D, I don't know, whatever. But you have to say what is in order to qualify to be correct for this game. Now, obviously, on the real NCLEX, it's not Jeopardy style. They don't give a shit if you say what is, what is not. You just have to say the right answer. But just because we're playing for incentive, yes, we're playing for prizes. The person with the highest amount of points at the end of the game will win a free Ultimate Nursing School bundle to help you with your studies. Okay, for everybody else that, just in case you don't win, it's okay. You can still get the Ultimate bundle and honestly whatever bundle's on sale within our summer collection for 60% off. Okay, that started today and that will go on until Monday. All right, so if you want to save 60% on some of our hottest summer items, all the bundles, all the NCLEX Arcades, even the nursing school, not nursing school, but the Nurse Life Planner, 60% off. So it's like $20. Regularly $49.99. Get it while you can, because we have like 40 something left. Once we're sold out, we're sold out. Okay, just letting you know for the planners. But okay. So yes, you have to say what is whenever you're answering the question. You have to be the first person on my screen to answer. All right, so to correctly answer, let me say that. Okay, so I'll just say that. All right, so if you have any more questions or if there's something that you need clarification on, just ask in the comments, but we're going to go ahead and get started, okay? So I'm going to go ahead and pick a question. We're going to let's start with fundies. Okay, let's start with fundies. All right, here's your question, guys. Fundamentals for 300. I got my scoring pad. You do not have to wait for me to read the question to answer, okay? Especially now that it's up. Yeah, just type the answer, but you have to say what is. So what is A, B, C, or D, whatever. But you have to say what is and be to qualify for the points. I'm trying to get to a blank page. 1 second. Oh my, I guess I need a new notebook. This is embarrassing. Okay. It's literally like the last page. All right, so fundamentals for 300. A client has been admitted to the hospital for urinary tract infection and dehydration. The nurse determines that the client has received adequate volume replacement if the blood urea nitrogen level drops to which value? Is it A, 3 milligrams per deciliter, B, 15, C, 29, or D, 35? What is our answer? What is our answer? All right, so I'm seeing majority B's, but I see an A, I see a C as well, but majority of you guys say B. So let's go ahead and see what our answer is. Fundamentals for 300, and the correct answer is, drum roll please. What is B? 15 milligrams. What is B? Awesome job. Damn it. I was going to ask y'all, what's the normal BUN level? All right, so first of all, I don't know if you guys were with me when I did my my Sunday study hall on lab values, but just in case you're looking at this, you're like, that's not the normal BUN level. Yes and no. It depends on your publication. The range is pretty much similar. Okay, see, this is 6 to 20. I've learned 7 to 21. Yeah, but it depends on the lab from the publication of the publication of the book that you're studying. But whenever you have questions on the NCLEX, though, these little numbers may vary slightly, but they're always going to assess you on whether you know if something is majorly wrong or majorly right. So they're not going to give you a question and be like, is normal B with, like, it's not going to be 6. It's not going to be like 21. It's going to show you, right, I've learned 10 to 20. I've seen that too. So I just want to just let y'all know, just in case y'all get a question on the NCLEX and you're like, damn, I don't know if they're 7 to 21 or 10 to 20 or 6 to 20, whatever. It's going to be the amount that they give you is either going to be real normal or real fucked up. It's going to be like, for example, here, it's going to be real low or real high, like way outside the parameters, and not close to either end of the spectrum, if that makes sense, of the normal spectrum. All right, so here it says normal BUN level is 6 to 20. Like I said, I've learned 7 to 21. I've seen 10 to 20. But at least I know it's something to 20. Okay. Values of 29 and 35, those were the other answer choices. That reflects dehydration. Okay, so BUN is going to be high when the concentration of the urine is high. And when you're dehydrated, your urine is really concentrated, really, really yellow. All right. So whenever I think about BUN, I think about concentration. The higher the BUN, the higher the concentration. The lower the BUN, the lower the concentration. And that can help me figure out what symptoms to look for and what levels as well. Okay. It says a value of 3, once again, reflects a lower than normal value of the BUN, which means the concentration is lower. So if you have really dilute urine, then it's usually fluid volume overload. You have more fluid than concentrate. So it's usually fluid volume overload. You're too hydrated, if that makes sense. See, among other conditions. I'm not gonna ask that question. Okay, great. So let's see who the first person is to say what is B. Okay, I'm going to ask one more question about this low level of BUN. What's another condition? Because it says among other conditions. Can someone just name one other condition besides fluid volume overload where you may have a low BUN / very dilute urine? Can anybody just name just one? Just give me just one idea. What's something else that can cause a low BUN? Just riddle me that, okay? So let me go ahead and scroll back up to see who got this one first. Who got it first? Catherine 518. Great job. Okay. And that pen does not work. Haha, got it. All right, so Catherine, where you at? Catherine _ 518. Congratulations and great job. You on the scoreboard with 300 points. Who else got what is B? Like I said, on the real NCLEX, it's not Jeopardy style. This is just to make it fun and less scary and overwhelming, okay? Who else got what is B? Or said B? Catherine got the points, but I Love Jesus also got it. Autumn Lorena, it's Kiki, Pure Buyout, Nursing Review Academy, Brie Couture, Britt B, KK and Nova, Jenny B, Jesse, It's Just Baby, Alexis, great job. Awesome job. I'm going back to what your answers were. All right, so your answers. So something else that can cause a low BUN or dilute urine. Lisa, you said SIDH. It's actually the opposite of that one. It's DI. So diabetes insipidus would also cause it. When I think about diabetes insipidus, because it's DI, I think about diluted urine. So that's how I kind of know for me. So that's just another example. Kidney failure. Yep. Well, a decline in kidney function actually can cause an increase in BUN. So kidney failure wouldn't be a low BUN, it would be a higher BUN. We are nurse fits to diabetes insipidus. Great job. Heart failure, depending, because you don't know if it's congestive or like congenital. It depends. DI, dry inside. Great job. All right, next question. All right, next question is mental health for 200. This is for both. All right, you got to know your lab values and all the stuff. You got to know whether you're an LPN or RN. You got to know all of it. Mental health for 200. Okay, great. The nurse is caring for a client diagnosed with paranoid personality disorder who is experiencing disturbed thought processes. In formulating a nursing plan of care, which best intervention should the nurse include? 1. Increase socialization of the client with peers. 2. Avoid using a whisper voice in front of the client. 3. Begin to educate the client about social supports in the community. Or 4. Have the client sign a release of information to appropriate parties for assessment purposes. What is our answer? All right. Whenever you read a NCLEX question, or any question, honestly, especially when it's in nurse school, you want to make sure you're understanding what the question is really asking you. All right, they're gonna throw a lot of information at you, but sometimes half of that is null and void. So you have to really understand what the question's asking. So what I do is after I read the whole thing once, I go back and reread the last sentence, which is usually the actual question, what they're asking you, and to make sure I really grasp what they're asking. All right, it says in formulating a nursing plan of care with somebody obviously with paranoid personality disorder, which best intervention should the nurse include? All right, so let's look and see. What do we know about clients diagnosed with paranoid personality disorder? What do we know about that? All right, let's go ahead and see what our answer is. Mental health for 200, and the answer is, drum roll please. What is 2? Avoid using a whisper voice in front of the client. Is it true? Read this question. It says, is it true with intervention questions they say assess before distress? What does that mean? Assess before distress. I don't know what that means. Like assess before you being distressed? I'm not sure. Let me know what you mean, Pure Bio. All right, so yes, I Am the Ambitious One says what we know about clients with paranoid personality disorder. They are always on guard. They are paranoid. Let the name help you. What do you know about people that are paranoid? They are always suspicious, and they are always, you know, thinking someone's out to get them, or just really just suspicious and distrustful of others, as it says. All right, so if you have somebody that's already suspicious and giving you the side eye just because that's the disorder that they have, whispering is not what you're gonna do. They're gonna be like, I know you're talking about me. Square up. It's gonna happen. It's going to happen. So that's what you gotta know and remember about paranoid personality disorder. They're super. Someone said they have trust issues. No Drake. Trust issues. No Drake. Period. Okay. So if you go around whispering with somebody with trust issues, that's not gonna end well. All right, it says disturbed thought processes related to paranoid personality disorders are the client's problem, and the plan of care must address this problem. All right, the client is distrustful and suspicious of others. The members of the healthcare team need to establish a rapport and trust with the client. Okay, laughing or whispering in front of the client would be counterproductive. It just would be. The remaining options ask the client to trust on a multitude of levels. These options are actions that are too intrusive for a client with this disorder. They're just not going to trust you all willy-nilly. Trust is earned, okay? All right, so who's the first person to say what is 2 for this one? A lot of people said what is 2, so great job. First person, though, is my dog, Catherine. Right again. Great job, Catherine. What is 2? You had 300 points. You just got another 200. So now you have 500. Who else got it? Mabel 1103, Pure Buyout, Ash the One, PR Into Freedom, Liz, Brie Couture, Jenny B, PR Into you answered again. Britt B, Linz A, Miss Queenie. Great. Awesome. Awesome job. All right, now let's go into our next question, which is Pete's. Okay, I know this one is long. This one is long, but it's needed. All right. So this is pediatrics for 400. Okay. A child who sustained a fractured ankle has a short leg cast applied, and the nurse provides home care instructions to the mother. The mother returns to the emergency department 16 hours later because the child is complaining of severe pain. The nurse notes that the child's toes are cool, pale, and puffy, and that the child is agitated and crying loudly. The mother states, I gave her the pain medication you sent with us, just like you told us, and I have kept her foot up on 2 pillows since we left, except for when she gets up to go to the bathroom. I don't understand why she hurts so much. Do something. What is the most likely clinical situation that occurred? 1, compartment syndrome. 2, inadequate pain medication. 3, skin breakdown around the cast edges. Or 4, non-compliance with home care instructions. Okay, so I know this one's a little lengthy and as far as the actual question, but I wanted to include that because you're going to start to see more questions that are like this. This is an example of, I guess you can, this is as close to a case study type of question that you're going to get without it being an actual like case study. Okay, they're going to give you like real life things that happen so you know how to move and you know how to handle it and assess and still use your nursing critical thinking. Okay, it's not going to just be, you know, not every situation is going to be that straightforward and being like, what is the normal value of this? That's not how real nursing works. It's not. You're going to get situations to which you're going to have to use your clinical judgment to determine the right course of action for you as a nurse. Okay, so what is the answer to this question? All right, so let's go back over it. We have a child who sustained a fractured ankle, has a short leg cast applied, and the nurse gave them home care instructions. All right, 16 hours later, readmit to the ER complaining of severe pain. Okay, When the nurse assesses the child, toes are cool, pale, and puffy. The child is agitated and crying, not softly, but loudly. Okay. Mother's going crazy, going berserk, obviously because her baby's in pain. We can all, whether you have kids or not, we can all understand that. So let's try to figure out what's the most likely clinical situation that's occurring. Is it their pain medication not working? Is it compartment syndrome? Is it skin breakdown around the cast edges that's causing all this? Or is it just non-compliance with home care? Okay, let's look and see what that answer is. Pediatrics for 400, and the answer is, what is one? Compartment syndrome. Compartment syndrome. All right, let's go scroll back up and see who got it. Catherine is eating y'all up. I'm just kidding. Everyone's getting it correct. Everyone that chose one got this correct. Catherine is just, I don't know what Wi-Fi she got. But she's answering these questions first, okay? But like I said, I just wanted to just remind you, because some people have anxiety. That's not how the NCLEX. Okay, the NCLEX isn't competitive. You're not trying to race the clock with Susie next to you. It doesn't matter. They can't even see her stuff. All right. Hold on. Ooh. This is friendly competition. Is just for this game, just to make it fun while you review for the NCLEX. But as long as you get those answers correct, it don't matter if you first, third, ninth. As long as you got that right within the time frame allotted, you're good. You're winning. So congrats. That's why I like to read off everyone that still got it correct. Because just because you answered third does not mean you are going to fail the NCLEX. You're just not going to be first place in NCLEX Jeopardy. But you're going to be first place in life when you pass this NCLEX. Sorry. All right. So first person, like I said, is Catherine. So she had 500 points before. Just got another 4. So you now have 900 points, Catherine. Great job. All my other boos, even though you did not get it first, you're still getting it correct. And that's all that matters. Unknown Beauty, Ash the One, Future ER Nurse, D. Durham, Liz, I almost said Autumn Night. Y'all watch P-Valley? I Am the Ambitious One, Beauty is Her Name, PRN to Freedom, Lynn's, Britt B, Shay Nell, Cajun Kells, Couture Events, Just Too Sweet, Jazz, Immaculate Michelle, Julie, great job. The 5G Wi-Fi. Oh my God, Ash, you take your NCLEX tomorrow? Oh my gosh. Now, you've been coming for a little minute. Congratulations, because I already know you're finna pass. I can't wait to hear what happens in 3 days. You can take it tomorrow, 2 days later. Damn, so it's like after the weekend. Let me know how it goes. I know you're going to do amazing. Good luck to you. Good luck to you. You got this. All right, so let's get back into the actual breakdown. All right, so it says, once again, the answer is compartment syndrome. So what is compartment syndrome? Okay, I learned what compartment syndrome from, I learned what it was from Grey's Anatomy. Do y'all know what episode I'm talking about? If y'all a Grey's Anatomy fan like me, like old episodes. But anyway, compartment syndrome, that occurs as a result of pressure buildup within a tissue compartment, like a compartment store, a compartment in your leg, whatever, that's bound by anatomical structures such as fascia. Okay, so with a fracture, the pressure increase that occurs after the fracture that may occur as a result of like an intense inflammatory response or severe bleeding caused by the bone injury. All right, so even that can occur even with the best nursing care, anything. That's just something that can happen. What's it called? That's just a complication that could occur, but you don't know when that's going to happen until honestly it happens. So you just that has nothing to do with your ability to nurse, give instructions. That's not anything to do with you. People are going to blame me, but it's fine. But that's just something, a complication that could occur due to the bone injury. It says that, like I said, the only way to really know when you're, to suspect compartment syndrome really is when the client is complaining of pain that does not match the injury. Okay, now mind you, the child did have a fractured, leg, but the way the question is describing it, especially the mom, the patient came in with severe pain. Okay, like severe uncontrolled pain, because remember, they had their pain medication at home. It's only 16 hours post break. All right, so they're not going to be on ibuprofen 800 in 16 hours. They're still going to be on probably their narcs or something like that, depending on allergies and stuff like that. But they're coming in almost like somebody stabbed them in the eyeball. Like it's not matching. It's giving disproportionate. Okay, so pain disproportionate to the injury site or the injury despite analgesic administration is the classic sign of compartment syndrome. That's just a really long way of saying uncontrolled pain. Yeah, that does not match up with the injury. Says the nurse should constantly assess for this complication and should instruct the caregiver about the manifestations associated with this complication. All right, now remember, that's, Ash the one. You better come through with this assessment. You better come through with this assessment. I was just about to ask y'all now. Remember, they said that when the nurse checked or assessed the patient's leg, it was cool, pale, and puffy. Those are also that lets you know that is there blood flow going to the toes? Is there blood flow? Yes or no? Is there blood flow? Yes or no? Okay. The answer is no. The answer was no. All right, that's why it was cool, pale, and puffy. You're not getting no blood flow to that area. Okay, now that is a result of the complication of compartment syndrome. That's basically, how can I describe compartment syndrome? It's like, it's a pressure buildup, right? It's like, for example, they're just like almost like bleeding internally within the leg. Like the compartment is only like this big. Example, the compartment's only this big, and it keeps filling up with liquid blood. Okay, it keeps filling up, and that's increasing the pressure. All right, so eventually, just like what happens when you fill a balloon up too much? Imagine that balloon to be your leg. That's the case with this child in this particular client. All right, they have a balloon, a water balloon that's literally about to burst as their leg, but it's their leg. So, the skin, the fascia, all that's not as thin and delicate as a balloon, so it's not going to burst. Instead, it's going to put up all that pressure on the fascia and still create devastating effects like cutting off blood flow, which can cause you to lose that leg, definitely. And yes, the fix to that is a fasciotomy. All right, they need to let all that blood out. So honestly, the best thing to do and the quickest thing that the provider needs to do is the fasciotomy. And that's when they take the scalpel and make an incision into the fasciotomy, and that will and the blood will just honestly go everywhere, because it's a buildup of blood. That's what that is. So that blood needs to go somewhere other than that small compartment, which is how you get compartment syndrome. Does that make sense? Right. Okay, great. I was looking at what y'all was saying. Whoop, whoop. All right. What was that? Peds, I think. All right, let's go to our next question. Farm for 500. All right. A client begins to experience extrapyramidal side effects from an antipsychotic medication. The nurse anticipates that the primary healthcare provider will prescribe which medication to treat this condition. 1. Haloperidol. 2. Benztropine. 3. chlorpromazine, or 4, prochlorperazine. What is our answer? Hold on. Wait for it. Okay. Let's look and see what that answer is. What was that? Farm? Farm for 5, right? All right, so our answer is, what is 2? Benztropine. Okay, what is 2s? All right, first person to get that was Unknown Beauty. Hey, boo, hey. All right, Unknown, you are on the scoreboard with 500 points. Who else got it? Literally, probably everybody. Unknown Beauty got it first. Future ER Nurse got it. Catherine, Autumn Night. I'm sorry, I know your name's not Autumn Night, but I just cannot not call you that. You feel me? I'm so sorry. Baby, I Am the Ambitious One, The Doll Stacy, Liz, Bentakib, Britt B, Immaculate Michelle, Fabri Bew, Ash the One. Okay, everyone got that one. I'm so proud. I'm so proud. Bit said, schizophrenia made me fall in love with mental health. I hated it at first. I did too. But there's nothing that I hate more than GI and respiratory. I fall asleep every time. I hate those chapters. But yeah, mental health is fine for me. What I learned about mental health is that the more mental health questions you do, you realize this sounds bad, but you realize there's like a pattern. Well, whatever. You realize there's a pattern how A, to answer these questions, and B, how to really in real life deal and communicate with mental health patients. Because that therapeutic communication thing is really big, especially in mental health. A good movie for Words on the Wall about schizophrenia. Is it Words on the Wall? Oh, that's good. Y'all know I love I love, when I'm learning about diseases, I love watching movies with that disease. Do y'all do the same thing? Let me know. All right, so it says benztropine. All right, that is an anticholinergic. Now, if y'all are new to me and NCLEX Jeopardy, me and the way I teach, plus NCLEX Jeopardy, whatever, y'all know that whenever I come across anticholinergic, I'm going to ask y'all the same question because I am going to burn it into your brains, because I promise you, you're going to see it on your NCLEX at least once. It's going to happen. It is going to happen. So, anticholinergics. What are, damn, future ER nurse, don't do that to me. You've been coming for forever, so you already know. All right, y'all, for anticholinergics, what are the common side effects of anticholinergic medications? What are the, if future ER nurse pretty much said it, can't see, can't poop, spit, there's a 4th one. It's 4 things that you need to definitely know, okay? What are the 4 side effects? And I remember them just like future ER nurse that can't see, can't poop, can't spit. There's a 4th one that rhymes with spit. There's 4. Thank you, Bentakib. Can't see, shit, spit, or pee. So I remember because they rhyme. Half of them rhyme. Can't see, can't pee, can't shit, can't spit. That is how I remember it, for real. Can't see, blurry vision. Okay, can't shit, constipation. Can't spit, dry mouth. I almost forgot. Dry mouth. And then can't pee, urinary retention. Okay? That is how I remember those side effects. Right. And just when you say it back, can't spit, think about it. When you can't spit, it's because you have a dry mouth. If you can't shit, it's because you're constipated. If you can't see, you're blind, but blurred vision. And can't pee, you have urinary retention. Okay? Know those. Okay? You probably won't get a question like, what are the 4 side effects? So you're not going to get a question like that. What you're most likely going to get is a question like, they're not going to tell you it's an anticholinergic. Okay? They're going to give you the actual medication and then say, patients coming to you and they're complaining of dry mouth, or what is a way for you to, they're complaining of side effects. What is a good patient education or teaching regarding this medication? And you have to know that medication is an anticholinergic. You'll have to know the side effects, and you'll have to know the patient teachings and considerations / interventions for each of those. So for like, how can you make a patient more comfortable with dry mouth? Mouth care, sucking on those little candies, things like that. Blurry vision, what's the big thing with blurry vision? You want to make sure that the client is safe. So if someone's having blurry vision, patient education is most likely going to be sit your ass down. Okay? You can't see, and I don't want you to fall, and I'm not writing that note. I love you so much, and I don't want you to get hurt. However, sit. Okay? You can't see, you can't walk. So sit. Can't pee, urinary retention. It'll be most likely maybe a drug for that. I can't remember. And then what's the other one? Constipation. How do you cure? Prune juice, girl. Here you go. Something like that. So yeah, I just wanted to burn that into your brains now, because I'm telling you, it's so funny that before I even got it out, Future ER nurse was already like, I already know what you're finna say. Exactly. All right, so back to, furosemide. Oh yeah, duh. Benzodiazepine. All right, like you said, that's an anticholinergic medication. It's used to treat drug-induced extrapyramidal reactions, except tardive dyskinesia. I don't know about y'all, but I mix those two all the time. All right, it's funny because the remaining options are antipsychotic medications, and antipsychotic medications can cause extrapyramidal reactions. So I'm glad they added that in there, because if you didn't know what the other ones were, you should, or didn't know what benzodiazepine was, and you knew that the other ones were anti-psych medications, you'd be like, what? Why would you do that? That's like giving somebody who has high blood sugar some Kool-Aid and be like, here, take this. All right. Wait, hold on. Let me go back to what y'all saying. No. I ordered the first semester on yesterday. Woohoo! I'm so glad. Thank you, Britt B. Send me pics. Something. I want to know how you're liking it when you do print it out. No, UWorld is not by Sam. Sam has NCLEX Arcade because Sam is a visual learner. I personally do not use UWorld because if you look up visual learner in the dictionary, like my face is there like this. I'm a visual learner to the T. I can't. UWorld was way too, I'm going to just say it. UWorld was way too plain and boring for me. It has helped countless amounts of people. I am just not one of those people because it's just not the way that I study. No shade to UWorld or anyone that has used UWorld. I'm so glad it worked for you, love. I am so glad. It just did not work for me. So that's why I had to create my own NCLEX review specifically for visual learners, that, especially ones with ADHD, because listen, my attention span, short. So I have to be entertained and really interested in what I'm reading, or at least, even though if it's not entertaining, like it's not always going to be entertaining. Duh. So I have to make it interesting for me to learn it. So that's honestly why I do all of this, because I just want it to just be, nursing school is already a walking panic attack. Like, I'm sorry, like, I'm not going to nursing school to A, better myself, and then B, go to therapy for 9 years afterwards to deal with the trauma. Like, I just have to have a healthier way of getting through nursing school in a way that was true and authentic to me and my learning style, and I wasn't going to apologize to anybody for it. So I just made my own stuff, and luckily for me, there are other visual learners in the world that had the same issue. So I just want to just get that into you. Hold on, go back to what y'all saying. Yes, I'm everyone can visual. Woohoo! Thank you so much. I'm new to your page, a graduate LPN school in January. Woohoo! Congrats! Yay! Thank you, T 2 times. And do you have anything for med terminology? Pronouncing many Medicare struggle at times. Nothing yet, but that's actually coming up in August. So stay tuned for that. All right, guys, let's go to our next question. That was farm for 500. Did I give the points? Yes, it was unknown beauty. Let's go to adult health for 100. Yeah, adult health for 100. The nurse is providing discharge instructions to a client following gastrectomy and should instruct the client to take which measure to assist in preventing dumping syndrome. 1, ambulate following a meal. 2, eat high carbohydrate foods. 3, limit the fluids taken with meals. Or 4, sit in high phallus position during meals. All right. Remember I said my method. You really understand what the question's asking you. All right. Look at the situation, and then look at the questions asking you. All right. Discharge instructions to a client who just had a gastrectomy. You know what the gastrectomy is. If you don't, I guess med terminology would definitely come in hand. All right. They had some with their stomachs. Surgery on their stomachs, okay? And should instruct the client to take which measure to assist in preventing dump syndrome. All right, so first of all, you got to know what dumping syndrome is. And then you have to know what can cause dumping syndrome or what aggravates dumping syndrome. And then to answer the question, know what you can do to prevent dumping syndrome from happening. Okay, so let's go through it now. What is dumping syndrome? Let the name help you. Let the name help you. I don't know if y'all from the South, but dump does not mean garbage dump. Like, what does dumping syndrome mean? Future ER nurse, I take med surg and mental health in the fall. Future ER nurse, I don't know why. Even though your handle literally says future ER nurse, I just feel like you've been coming to NCLEX Jeopardy for so long and killing it for so long. Like, I feel like you've taken and passed the NCLEX like 3 times already for some reason. I don't know why. Because you've been killing it on NCLEX Jeopardy for like, I don't even know how long. So long. Yep, dump means poop. All right, so let's get into what the actual hey, NC Pink Rose, I'm late, but clients poop as soon as dumping syndrome. Syndrome of dumps. I'm just kidding. All right, so let's get into the answer because I think it explains it in the next slide. What is this? Adult health for 100. All right, so the answer is, what is 3, guys? What is 3? Limit the fluids taken with meals. Now let's get into why it's 3. A lot of people chose 4, but let's get into it. So, dumping syndrome. It refers to like a cluster of really symptoms, and specifically vasomotor symptoms such as diarrhea. We'll talk about it right here. But diarrhea is definitely one of the big ones. Dumping syndrome, somebody shitting. Somebody is shitting. All right, so that can be diarrhea, nausea, lightheadedness, wanting to go to sleep immediately, like the itis. Okay, So that desire to lie down, that's a PG way of saying the itis. Okay. All right. That's caused by rapid gastric emptying. All right. So right after they eat, due to that rapid gastric emptying, it's like the food goes straight through them. All right. It just dumps straight through them. And you got to go take it down. Okay. It says that early manifestations usually occur within 30 minutes of eating and include vertigo, tachycardia, syncope, sweating, pallor, palpitations, and the desire to lie down. I would definitely add diarrhea to that because it's important. Okay. Now that you know what causes dumping syndrome, the certain manifestations of dumping syndrome, now we have to take it a step further and figure out how to prevent those things from happening. Okay, how do we prevent not dumping syndrome? Because honestly, that you can't really prevent. Well, you can prevent some of I'm gonna shut up. You can decrease the chances and you can manage it. But if you're going to get those symptoms, you're going to get it, especially after that type of procedure. It says the nurse should instruct the client to decrease the amount of fluid taken at meals and to avoid high carbohydrate foods, including fluids such as fruit nectars. And that it says then to assume a low Fowler's position during meals. Really? High Fowler's is this. Low Fowler's. Why would I eat in low Fowler's? Oh, to slow down gastric emptying. That's good. Okay, anyway, sorry. To lie down for 30 minutes after eating to delay gastric emptying and to take antispasmodics as prescribed. Okay. Let me scroll down to what you're saying. Ash, it's 3 because you're not supposed to sit up. You're actually supposed to lie down. Great job, Ash the one. And I just read that part too. Running right through him. The food is a runner. It's a track star. Through the gastric. She's a runner. She's a track star. So I just taken fundamentals. Really? Girl, you've been killing it. Never change your answer. Remember what I said about second guessing. What else? Patients with GERD sit in a high Fowler's position. Yes. That was good. I'm so glad. That was good. I was always told about dumping syndrome. Stop gravity. Right, to slow down gastric emptying. All right, we all learned something today. Okay, let's go into, did I get points? Nope. First person to get that. Did I say it? Hold on, let me go back up. What was the answer? 3? Okay, let me scroll. Scroll. Ooh, Liz. It's funny because you would have been first, but you changed your answer. You had the first answer was correct. So that means the next person that got it right was Baby. I don't know why I want to say Baby Asa, but Baby Asa. Baby Aspirin? I'm just kidding. Congratulations, boo. Okay, ASAAP. Great job. For what? 100 points. Awesome job. All right, so we have Catherine on the scoreboard with 900 points, Unknown Beauty with 500 points, and then Baby with 100 points. Great job. Who else got it? Did anybody else get that? Dream Nails. Great job. Ash the one once again. Great job. Assad. Okay, gotcha. All right, next question. What was this? Adult for 1. All right, next question. Fundamentals. Fundies for 100 points. The nurse is caring for a client with a severe burn who is scheduled for an autograft to be placed on the lower extremity. The nurse creates a post-operative plan of care for the client and should include which intervention in the plan? Sorry, I was reading what y'all was saying. 1, maintain the client in a prone position. 2, elevate and immobilize the grafted extremity. 3, maintain the grafted extremity in a flat position. Or 4, keep the grafted extremity covered with a blanket. Skin grafts. I also learned this from Grey's Anatomy. If I haven't said it enough, or if y'all can't already deduce that, I literally watched and rewatched Grey's Anatomy as I was studying I'm not joking, the entire time I was in nursing school. That in private practice. Once again, I'm a visual learner, so you already know. I love to watch movies and shows, or at least have it playing in the background while I'm studying a specific disorder or whatever. And it honestly, it helps me study, because if I can't remember what I'm reading, I'll remember what's playing in the background and then try to link, okay, when that was playing, what the fuck was I reading? That's how I nurse am studying. All right, so let's look and see what the answer is for this. A lot of people saying 2s and 3s. So which one are you gonna do? Are you gonna elevate and immobilize, or are you gonna put it flat? Elevate or flat? Which one is it? Let's look and see what the answer is. Fundamentals for 100, and the answer is okay. I was like, what the fuck? Elevate. What is 2? Elevate. Like the Instagram church. Elevate and immobilize the grafted extremity. Okay, it says autografts placed over joints or on lower extremities are elevated and immobilized after surgery for 3 to 7 days, depending on the surgeon's preference. The period of immobilization allows the autograft time to adhere and attach to the wound bed. The elevation minimizes the edema. All right. Keeping the client in a prone position and covering the extremity with a blanket can disrupt the graft site. Okay. So yeah, the answer was 2. Hold on. This was fundamentals for 200. No, 3. Fundies for 3. Really? I think this was supposed to be 100, and yeah, it's actually 100, and I did not change the number. My bad. All right, so yeah, the answer, I have to go back to the question. The nurses came for a client with a severe burn, scheduled for an autograft on the lower extremity. Intervention for the post-op plan of care. So it was 2, elevate and immobilize. All right, great job. So let's like say, give us our 300. Now this is 100 points, because I said it in the beginning. It's 100 points. This particular side was it. Do we have funnies for 300 already? I don't remember. That's something else. So let's see who got it first. What is 2? Ash the 1. Great job. All right, Ash. What's this? 100 points. Awesome job. Who else got it? Unknown Beauty, Baby Assad. It's Lexi. Good job, it's Lexi. That's what he was like. Give me my points. Period. But we would have got that right. Mia Amore, NC Pink Rose, Dream Nails. I'm the ambitious one. Ash, the one that I had guessed. Hey, so it'd be like that sometimes, because I definitely guessed on a few of my NCLEX questions. You are not gonna get me. All right, great job. Let's go to the next one. Mental health for 500. Mental health for 500. All right. An understanding of borderline personality disorder should help the nurse determine that which problem is the priority for the client. 1, isolating self. 2, inability to cope. 3, low self-esteem. Or 4, risk for self-harm. An understanding of borderline personality disorder. Y'all have my mental health kit? I hope you do. It's in the Ultimate Nursing School bundle. Ultimate Nursing School bundle and the 3rd semester bundle. Open that thing up. It's the one that's like Scooby-Doo themed. Yeah, open that up if you don't know what borderline personality disorder is. Okay. Let's look and see. A lot of people... Listen, said I actually have no clue. That's okay. We're going to go over it because after this, you will have a clue. All right, let's go into what it is. Somebody really quick, tell me why you think it's what it's for. Type it. I'm still going to be changing it to the answer slide. Mental health for 5. The answer is, what is 4? What is 4? Risk for self-harm. That is the priority. Safety first. Absolutely. Safety first. Okay. Now, I did not know this specific fact. But I always know that safety is a priority. So honestly, little hack for me, whenever I have especially like mental health questions, and if I see the word priority, like which one's the priority on any mental health question, and it's something related to self-harm, unaliving yourself, all that, I'm choosing that answer. I'm choosing that answer because I'm choosing that answer. You know why? Because client safety. And there is nothing more priority than making sure that that patient stays alive. So if they have a direct risk of being unalived, not just injured, but unalived, that's going to be the priority. Yes, ma'am. Yes, ma'am. That's going to be the priority. Absolutely. Absolutely. We can... all the other stuff, we can intervene on that, but I need you here, all right, to do the other lesser priority interventions. I need you here first, okay? So clients with borderline personality disorder, they're most often hospitalized because of impulsive attempts at self-mutilation or unaliving. I'm going to say that. The nursing intervention of constant close observation is usually initiated to protect the client from impulsive behavior, okay? If any of the other options exist, once again, they're of lesser priority. I discovered the word unaliving because I just be on TikTok. But I'm glad I learned it. Okay? That's kind of what I think of. Right, exactly. So kind of, even when you have that situation, that's you thinking critically. Okay, not every question on the NCLEX is like something that like you have to be in your book about. Some stuff is, I won't say common sense, but it's common nursing sense. It's critical thinking. It's something that you're definitely going to improve on, especially as you get through nursing school. If you're in your first semester and you don't have critical thinking skills, do not feel bad because I didn't have them either. Okay, it's something you get with practice. The longer you go through these situations and really think critically, that's honestly how you get it in practice. Just not rehearsing, but just practicing that part of nursing school. Okay, you do that by taking questions and really assessing yourself to make sure you know what to do in any type of situation. Okay, next question. Wait, did I give points? No. Who got that first? Let's look. Risk 4. A lot of people said 4. And it was first person. Now it's Lexi. You know you're supposed to say what is. You would have been first. But just know, you answering these questions correct, sis. I'm very proud of you. First person to say what is 4 is actually Baby Assad. Baby Assad, you are already on the scoreboard with 100 points, and you just got another 500 points. So you done jumped up into 600 points. Look at y'all. I'm just like a proud mama. Y'all heard me say that so many different times. All right, who else got what is 4? Because like I said, on the NCLEX, you would have got it right, period. It's Lexi, Shay, Nell, Mia Moore, Dream Nails, Liz, Linz, okay, Merle Flay, it's Kiki, Real Ken, Lissa, NC Pink, oh, sorry, not Lissa, NC Pink Rose, Benta Kib, Britt B, Melissa's actually having a clue, but that was a good guess. Macla Michelle, Hey P. Hargrove. A lot of people was thinking 2, which was an inability to cope. But once again, safety is priority. Great job. Awesome job. Critical thinking. It doesn't come easy out. It doesn't, but it comes with practice. That's why I do these for an hour for free every week. I want to make sure y'all get y'all practice. Okay? All right, last question. Mental health. That was just mental health. What's the next one? Hold on. Which one do I want? We actually have 2 questions. Wait for it. Okay, actually, it's like 3 questions, but that's fine because I want y'all to get these questions. Which one do I want first? This one. Adult health for 300. All right. This one's going to be the last one. I'll just put all the rest of them up on the app. All right. The nurse has admitted to the hospital a client with a diagnosis of an acute attack of Meniere's disease. The nurse reviews the primary healthcare provider's prescriptions for the client, which prescription should, oh, sorry. I just completely just ran right past that period. Sorry. Which prescription should the nurse question? 1, diazepam. 2, nicotinic acid. 3, diphenhydramine. Or 4, ambulation 4 times a day. Ooh, I just wanted this question. I'm so glad we have this question. I'm so glad we had this question. All right, so let's go back to the question. All right, so the client has a diagnosis of what? Meniere's disease. What do y'all know about Meniere's disease? Just, it can honestly be, give me a fact. Give me, when you think of Meniere's disease, what is the first thing that pops into your head? Just answer that. What is the first, answer the question. But then tell me the first thing, whether it's a word, sentence, whatever. Tell me the first thing that pops into your head when you think of Meniere's disease. It's Lexi said vertigo. Water in the ear, vertigo. Future Ear said nothing because I don't know what that is. All right, so first of all, 2 things pops up. 1, there's a clothing line called Meniere Duvois, and I love it. 2, Meniere's disease, I think of vertigo. All right? Now, with, and that ear imbalance, and this, vertigo. Men can cause it. I don't know why that took me out, but that was funny, Real Ken. That was funny. All right, so we're gonna walk through this. Okay. Now, Future Ear said, "What is 5?" Good night. If you associate vertigo with Meniere's disease, all right, just run off that. It says the nurse reviews the primary healthcare providers for the client. Which prescription should the nurse question? That's what it's asking you. It lists a prescription: diazepam, nicotinic acid, diphenhydramine, ambulation 4 times daily. Which one looks like it does not belong? Okay, which one would make us be like, are you sure this is right? Okay, which one of these would you question for someone with a disease about vertigo, which is dizziness? Keep that, pin that in your mind. Let's get into the answer. All right. I'm a client who literally just has bouts of dizziness all over the place. Okay, I'm dizzy. I have a diagnosis of being professionally dizzy. Okay, what is going to be an intervention, not intervention, what is going to be a prescription? All prescriptions don't have to be medications and drugs, just saying. It's whatever the doctor prescribed. I've had a doctor prescribe wine, not for me, unfortunately, but that's another story for another different time. Let's get into the answer for which question is this? Adult health. Here we go. And it's for ambulation 4 times daily. That's going to be what you question. Okay? It's going to be what you question. If I have somebody with, y'all remember like on the Disney shows or little cartoon shows, whenever they would get dizzy or hit in the head, they would have like the little thing. It's like birds and stars, just like. So when you think about Meniere's disease, honestly, visually, I picture that little thing around their head. And as I'm sitting, as the nurse, as I'm sitting there reading the prescriptions, and I look up at my client with the dizzy symbol and then see, okay, we're going to make sure that they ambulate 4 times a day. Do y'all watch I Am Dre Brown? Mr. Doctor, sir, or provider, because it can't be an MP. Mr. or Miss Provider, ambulate 4 times daily. You want my dizzy client to ambulate 4 times daily. So you want them to fall. Just let me know how many times so I can know what to do for me. Absolutely not. Okay, absolutely not. It says medical interventions during the acute phase of Meniere's disease include using diazepam as prescribed to decrease the autonomic nervous system functions. All right, so that's actually just one of the actual medical and pharmacological interventions for that. Diphenhydramine, which is, what is diphenhydramine? On the NCLEX, you're going to always see it as diphenhydramine. But in layman's terms, in real world terms, when you're doing your patient teaching, this you're gonna use the brand name because it's just in the real world, the non-NCLEX world, that's what you're gonna use. So that's why you really need to make sure you know both. Know the generic because that's all you're gonna see on the NCLEX. They don't have brand names, and then no brand names because it's usually more it's easier to say or just for patient teaching. So just know both. What is diphenhydramine? Down. All right, so diphenhydramine may be prescribed for its antihistamine effects, another hint as to what it is, and a vasodilator, which is nicotinic acid, will also be prescribed. The client will remain on bed rest during the acute attack. Right, and then it was an acute attack. It's not like they just, I had a dizzy spell like 3 weeks ago. They're literally mid-diz, sis, okay? When allowed out of bed, the client will need assistance with walking, sitting, or standing. Absolutely. Okay. So, I'm scrolling back up to see who said what it's for first. Boop, 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 boop. It's Lexi said I need my point. This one first incorrect, so you get your points this time. So it's Lexi is the first person to say what is for. That's underscore. It's Lexi underscore. You got 300 points. Awesome job. All right, who else got that? Unknown Beauty got it. Moral Flay, Benta Kib, Future ER Nurse, Ash the One, gotta get it. Chanel said I'm sending this one out. NC Pink Rose. Everybody said vertigo and dizziness. Great job. Ashlyn said I changed my answer 3 times. Definitely 4. Great job, future ER nurse. Chanel. It's Lexi. Big Jazz. Awesome. Yep. Okay, so back to that question about what does diphenhydramine? It's Benadryl. It is Benadryl. That pink pill. Yep, the antihistamine Benadryl. Okay. Definitely a fall risk. Lexi said, period. Right, sis. That was all you. Great job. And this is an acute attack. I didn't see that keyword. Okay. Great job. All right, cool. I was just going through what you guys were saying. A lot of people missed the fact that it was the acute phase of the attack. But yes, that played a key role as to why that ass was on bed rest. Sit down, sit down, sit down. Okay. All right. And, oh shit. Okay. 2 things. All right. That was the end of our NCLEX Jeopardy, so I'm going to get into the winner in just a second. But today was the start of our summer sale, okay? 60% off our summer collection, and it's just our summer faves, some stuff that if you don't already have it, this is a great and perfect time to get it, especially right before you get into school, or if you're in summer school, this is for you as well. Okay, so 60% off the Ultimate Nursing School Bundle, the ATIT's bundle, the first semester bundle if you want it. But the first semester is in the Ultimate Nursing School Bundle, so I would just get that one if you want the first semester, because then you get all those semesters. But just in case, the first semester is a part of it as well. NCLEX Arcade, if you want more NCLEX help, like I said, that is what I created for the visual learners that didn't, I wouldn't say didn't do so well with UWorld, but like, you're a visual learner. Okay, UWorld did not work for me. It was too boring. Hurst Review, it was too long and boring. So I created an arcade version, NCLEX Arcade. That's for sale for 60% off. You just gotta go to the app or to the link in my bio, thenurseam.com, and enter code SUMMER60 for 60% off. The planner is also on there. Okay. There's less than 50 of these are actual Nurse Life planners left, and after those are gone, they're gonna be gone forever. Okay, so if you definitely don't want to miss out on a physical planner, the physical Nurse Life planner, now would be the perfect time to get it. It's $20 versus $49.99 if you use the code SUMMER60. Okay, now I'm gonna go ahead and, first of all, how was it? Did you guys like the game? Did you guys love the game? Our winner for tonight's session is, with a whopping 900 points, it was Catherine_518. Round of applause. And great job to everyone on the scoreboard. Catherine, Unknown Beauty, Baby Assad, Ash the One, it's Lexi. Great job to everybody. All right, Catherine has the most points, so she's going to be the winner of our prize, which is a free Ultimate Nursing School Bundle. All right, so Catherine, if you do not have that bundle already, congrats, you just won it. Yay! Be sure to DM me your full name, first and last, and a good and correctly spelled, please, email address, so I can go ahead and email that prize to you. Congratulations to you, and congratulations to everyone that came and participated. Like I said, the best way to develop your critical thinking, review for the NCLEX, make sure you strengthen your test taking skills, even if you're in your first semester, even if you're not about to take NCLEX tomorrow. Good luck, Ash the One, or in the near future. I always say prepare to take NCLEX from the moment, honestly, you were, not the moment, but your first semester, right when you start. Practice taking those NCLEX questions, because once again, it's testing you on your nursing critical thinking, and that's something that just does not come to you by reading a book. You have to actively practice, okay? So congratulations to everyone that came for this free review. That's why I love doing these reviews. I do them every week right here on my Instagram live at 7 p.m. Every Thursday, unless I'm sick. Even when I'm on vacation, I'm here with y'all, okay? As long as I have my Wi-Fi, we're good, okay? Like I said, I do them every Thursday. We may or may not have to push next Thursday to Friday because my plane may or may not land by 7 p.m. But we gonna see. I'll let y'all know. I will let y'all know. Make sure y'all download our free app. It is called the Nurse Sam, 100% free. Download the free app if you want to play the rest of the questions from tonight's NCLEX Jeopardy. I'm about to update it right now, okay? Because you still have the previous questions, and I want to 21. Which one was that? Was it this one? And well, I want to make sure. Oh, this one, yeah. I want to make sure y'all practice the whole time, okay? So I'm going to update this so that when you download the app and then open up the NCLEX Jeopardy mobile, you'll be able to see the questions from tonight plus like 15 more. Okay, so you have 25 whole new questions. We didn't even do all 10. We did like 8 of them. All right, so you have honestly like 17 additional questions to go through. So hold on, because I'm literally about to do it right here in your face, so that when you download it and refresh it, it'll be in the questions. Because y'all know I got ADHD, so I will forget. Period. All right, here we go. And there you go. All right. Questions from tonight. The new 25 questions are now updated to the mobile version of the NCLEX Jeopardy, which is exclusively only found in the Nurse Sam app. All right, so that's what the icon looks like. It's literally called the Nurse Sam app. All right, while you're in the app, if you want to go ahead and use code SUMMER60 for 60% off whatever it is that you need to prepare for the NCLEX, TEAS if you're taking it, or just an exam in nursing school. Once again, it's free. It is free. You cannot beat that with a stick if you download the app and play 25 questions every week. All right. Usually you get like 1 question a day from somewhere. I'm giving you 25 a week. Okay. People be having 25 a month. I'm giving you 25 a week. All right. Period. Because I want y'all to win. All right. So once again, like I said, our summer sale started today and it ends on Monday. So use code SUMMER60 now for 60% off our summer favorites. Okay, it's the bundles of everything that you could possibly need to be successful. Join and find out why over 25,000 other nurses and rated us 5 stars, and I've already helped them get into nursing school, get through nursing school, and graduate and pass NCLEX. Period. Flex. All right, so if you want that to be you, make sure you like, follow, subscribe. You can either go to my YouTube and watch replays. This replay will be uploaded to my YouTube. Subscribe to my YouTube channel at thenursesamtv.com. That'll take you right to my YouTube channel. And this is where this replay plus some other replays from NCLEX Jeopardy and other videos will be uploaded to. All right, so thank y'all so much. Have a great night. I will see y'all next week for our next review. All right, have a good one. Wait, let me look at y'all comments. I did not know what y'all was talking about. Hold on. All right, that's great. All right, thank y'all. Love you. Bye.